Okay, so this is going to be my week 2 health assessment 2 video over abdomen. So the first thing I would do is just knock on my patient's door, provide privacy behind me, do my hand hygiene on the way in. I am going to acknowledge my patient, introduce myself, let them know what I'm about to do, how long it's going to take, and then thank them for letting me do the assessment. Next, I'm going to ask them their name and their birthday and match it with their ID band. I'm going to assess their allergies and assess any pain. So just starting out, just upon inspection, I'm just going to note the abdominal colors. So abdomen, the color of the abdomen, sorry. So it should be consistent with race. You're going to note their contour. I kind of have a rounded contour. I'm looking for abdominal symmetry. So it's easiest if the patient is laying flat and you go to the foot of the bed and just kind of assess for that symmetry. Then I'm just assessing the skin. It should be dry and intact. It shouldn't have anything, like nothing open or anything. You may see some like mild pulsations. That's normal. Then I'm going to inspect my umbilicus and kind of abdomen as well, just for any bulges, any hernias, masses. Your umbilicus should be inverted. So that's, we want that. But some people do have like outie belly buttons, and that's okay too. But some, like if you have like a hernia that's protruding your belly button, or, pregnancy, then that would be an indication of why it's, not inverted. And then I'm going to just looking at the skin of the abdomen. Like I said, the color is consistent with race. I'm just looking for any striae, any scars, or any lesions. That scars may indicate like past surgeries possibly, and just, assessing for any lesions. So moving on, I'm gonna move on to my auscultation. So I'm gonna assess my bowel sounds and my vascular sounds with my board. And sorry, let me move back here. So with my bowel sounds, I'm going to use the diaphragm of my stethoscope, and I'm going to start in the right lower quadrant. I'm going to be listening over bare skin, and I'm going to assess for a full minute. For the sake of this video, I'm not going to listen for a full minute, but in real life, I would. If I don't hear anything in one of my bowel sounds, like in my quadrants, then I would assess for the full 5 minutes. So I'm going to go ahead and use the diaphragm. All right, so I'm going to listen in the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. And then I'm going to move over to my vascular sounds. And I'm going to use the bell of my stethoscope, and I'm just assessing for any bruits. So a bruit may indicate like some stenosis at the artery. Okay. So this is going to be my aortic, my left renal artery, right renal artery, left iliac artery, right iliac artery, left femoral artery, and then right femoral artery. So just assessing for any bruits. Next, I'm going to move on to my palpation. So when I'm palpating my quadrants, I'm also going to palpate I'm kind of palpating for like any pulsations like near like the aorta. So first I'm going to, so I'll just go ahead and do the aorta one first. So I'm just going to so if this is your belly button, you would just kind of go a little bit and just kind of, move up and move down a little bit, just assessing for like any pulsations. And then next, so moving over to the quadrants, I would just kind of use like my 4 finger pads and just move in like a circular motion. And I'm going to just kind of assess in the right lower quadrant, and then I move to the right upper, left upper quadrant, and then left lower quadrant. And I'm just assessing for like any edema or any masses, anything that's, abnormal, and then assessing for the pulsations, which I had done prior. Next, I'm going to stand up for this one. I'm going to palpate my bladder, and then So I would want to make sure that my patient's bladder is emptied prior to doing this. So I'm just gonna kind of palpate. I don't have any tenderness or anything like that. Next, I'm gonna palpate the liver. So what I'm gonna do, and it'll kind of be like the border of the liver, like not actually like, you know, I'm not assessing the size or anything. I'm just gonna kind of feel a little bit of like the border of the liver. So if I move over to the right upper quadrant, I'm gonna have my patient inhale, and I'm gonna kind of push here, and I'm just gonna feel just kind of the border of my liver. Next, I'm going to test for, or I'm going to do a Murphy's test. So I'm also going to palpate in the right upper quadrant, and I'm going to have my patient take a deep breath. And then on expiration, I'm going to push firmly in the right upper quadrant. And they should not have any tenderness, so that would be a negative Murphy sign. Sometimes with, well, most of the time with cholecystitis, they will have the tenderness, so that would be a positive Murphy sign. Last but not least, I'm going to do my percussion. So I'm going to percuss my kidneys at the CVA, so the costovertebral artery. And I'm going to do it on my right and my left side. So I'm going to just kind of give my hand like a thump here. Sorry. And I shouldn't have any like tenderness or anything, which I do not. So if you had like, if you had a kidney infection, your kidneys are inflamed, you would have some of that tenderness when you do the percussion at the costovertebral artery. So that concludes my assessment. I'm going to reassess my patient's pain. I'm going to offer any like comfort measures, ask them if they need anything else. I'm gonna thank them for letting me do the assessment, do my hand hygiene on the way out. Before I leave the room, I just wanna make sure that the SAD wheels are up ×2, the bed is in lowest position, wheels are locked. Usually I make sure that the bed alarm is on or chair alarm. Call light is within reach, and then their belongings and like the phone and everything are within reach as well.